In Louisville and surrounding areas, we have particularly high levels of air pollution, and we have very, very high levels of cardiac death. In fact, in scientific literature, this particular area is called the Coronary Valley because we have about 2 times the national average incidence of cardiac disease and cardiac deaths. One of the reasons is that, of course, we have our air is not as clean as in other places. We are in the valley, so everything accumulates here, and so we have been non-compliant in several of the standards over the last several years in the air quality standards, and so we have to improve that. And the way we improve it is not just by just say we don't need this industry or we need to close this mill, but in the general attitude and more importantly how individuals in the city live their lives. So for instance, we have now zero emission buses which are not going to be spewing out these pollutants. That would make a difference. We need to have more green canopy. That would make a huge difference. We need to have parks. We need to have places all over the city. We have ready access to fresh fruits and vegetables. There are large areas of the city which are called like food deserts because there's no fresh food available. Right. So if a city consciously makes a decision that in order to positively affect the health of its citizen, it needs to change the way the city is built, and it supports walking and physical activity and interaction and community living, then it can change the lives of its citizens. And this has actually been done in cities like, I think Pittsburgh. They used to be a very polluted city. And when they cleaned up the environment, there was an actual increase in the lifespan of the citizens within the city. So the civic organization of a city and how it is run can have a powerful impact on the health of the people that live in the city.